healthcare providers knowing about the triple whammy, or is it when people see maybe
Things like the list of medications I get from the GPs are very different from when I see the patients and they said, oh, they might go to the pharmacy and if they don't get checked or
Hi everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of the Kidney Coach and co-founder of Kygenesis, a range of supplements designed for people diagnosed with chronic kidney disease. And I'm delighted to be joined again by becoming very fast one of my favorite guests, the beautiful Therese. Therese is a consultant pharmacist, health strategist, and wellness researcher who specializes in bridging the gap between traditional medicine and functional health strategies. She has a keen eye and knowledge on chronic diseases such as kidney disease, metabolic syndrome, high blood pressure, and she provides practical science-based solutions that empower individuals to take control of their health. But it still surprises me how many healthcare providers, and I don't know, you probably would see this in clinical time, but I often get older patients come to me that are on, I'm thinking of a really specific one I had with Parkinson's, who was on 27 different medications from about 5 or 6 healthcare providers. I'd spoken to you about this one before, and it just did not check. They were on 3 or 4 different types of levodopa, and because the patient doesn't know to check. But had triple whammy. In fact, I would call it a quadruple whammy because I think they had an ACE inhibitor and an ARB, 2 diuretics.
My goodness, wow.
Yeah, and an NSAID. And so,
2
and of course,
diuretics, goodness.
2 diuretics, and just had, again, different providers, an ARB and an ACE, and then NSAIDs. And has kidney, of course, issues because it's just not being checked. So would you say is it a lack of, and I'm not having to go at healthcare providers, but is it a lack of that healthcare providers knowing about the triple whammy, or is it when people see, maybe they see their general GP, then they might see a rheumatologist, and then on top of that, they might have a nephrologist, and which is, the case of my patient, and they're just not cross-checking medications. Is that what you think causes someone to end up on a triple whammy, or is it healthcare providers do need more education around this?
Oh my goodness, Fiona, you just opened this can of worms.
know,
All the above. One of the reasons why I'm doing these medication reviews is because your right hand doesn't know what your left hand is doing. So GPs are the central primary caregiver, provider. However, they send patients to specialists, whether it's a nephrologist for the kidneys, endocrinologist for diabetes. So we get all these silos all working independently, and sometimes because the patient sees them individually and not in combination, the message gets lost. So a lot of times, the list of medications I get from the GPs are very different from when I see the patients and they said, oh, this specialist, they've started me on this, or they've dropped the dose on this. So that's A. And then the second thing is trying to actually manage resistant hypertension is a problem. And most times you need 2, 3 combination agents. So it's not surprising that there is a need for an ACE inhibitor, which works to actually increase the relaxation of the vessels so that there's less pressure. And then you also use a different synergistic pathway, like with the diuretics, to remove excessive fluid, which causes pressure. So a diuretic like furosemide or hydrochlorothiazide. So they work in synergistic to actually reduce blood pressure. And then if that's still not getting them to 130, 80, if they've got chronic kidney disease, they might have to throw in another agent. And so it's not common that you have an ACE inhibitor with a diuretic and then a beta blocker, plus minus a calcium channel blocker. So already you've set the scene for really, really low renal perfusion. And then if the patient has pain and they go to the supermarket and it's available over the counter, and they might get a Nurofen, which contains ibuprofen, which is an NSAID, or they might go to the pharmacy and if they don't get checked, or nobody actually talks to them, and they purchase naproxen or something else that's only available in the pharmacy, you can see the writing in the wall that the triple whammy can easily feature, and the doctor might not be aware of it because they get these medications over the counter, so it's not in the system, so they can't actually run the necessary tests and precautions to ensure that they can lower the risk of kidney damage.
Thank you so much for being on the show. If you want to know more about what we do, head to www.kidneycoach.com. You'll find us on Facebook and Instagram under the same handles. And remember to hit subscribe and like. That way you'll get notified anytime we put up more content. And if you have any questions for Theresa, put them down below and I'll be sure to pass them on to her. Thank you again for coming back on and sharing your wisdom and knowledge and for being such an amazing pharmacist. I really appreciate you.
It's a pleasure.
All right. Thanks, everybody. Bye.